politics, business, sports, arts, music. Mike and Marty on the feed. Mike and Marty. Mike and Marty on the feed. Mike and Marty. Mike and Marty on the feed. Mike and Marty.
Good morning, Bellows Falls and Keene, and welcome to the feed. It's Mike and Marty. We're here today with Dr. Gavin Cotter. We're going to be talking about infectious diseases. But first, Marty with local events.
First day with a new tongue.
Yes, new teeth.
New teeth, even better. At the Bellows Falls Opera House, we have Downton Abbey, the grand finale. But it is only going to be playing on Monday the 6th and Tuesday the 7th because... Oh, it worked this time. This weekend is Taylor Swift, the official release party of a showgirl. Now, just so you know, it is only being shown Friday, Saturday, Sunday, and then it's going away. And I guess that's like across the country. It's only being shown this premiere
really
weekend, then it's
event.
going away. So it's a behind-the-scenes look of the making of her record. So that is at the Opera House this weekend in Bellows Falls. The classic movie tonight is The Last Waltz. It's a Martin Scorsese film. Oops. I'll get this down. It's a Martin Scorsese film, and it's about one of the last concerts of the band. And I'm like, that sounds kind of familiar, the band.
Yeah.
And then I started looking
It's
up
like-
the songs. I'm like, oh my God, I know
Yeah.
half the songs. If you grew up in the 70s and 80s, you know the songs. So it's not only just the band, but there was a lot of guest performers at that particular concert. Bob Dylan, Neil Young, Eric Clapton, Muddy Waters, Van Morrison, and Dr. John, just to name a few. On Saturday, Harlow's Sugar House presents their first Apple Fest. It's October 4th from 10 to 3. They'll have fried dough, apple fritters, hamburgers, hot dogs, a bounce house, some animals, and that's right on Route 5 as you're headed towards Putney. So something to do this weekend.
Okay.
And that's it for local events.
So, Dr. Cotter, thank you for coming today. We're going to be talking about infectious diseases, but first, why don't you tell us a little bit about yourself, where you practice, how you got here?
All right. Thank you for having me.
You're welcome.
Sounds like you have a lot of interesting stuff going on
Yeah.
in town. So I'm a private practice infectious disease consultant. My office is in Rutland, Vermont. Although I see patients all around in New Hampshire, but all throughout Vermont and even into New York. I see all sorts of different infectious diseases. I focus on adults. I'm not a pediatric infectious disease physician. I live in Mendon. My wife, you had her here a couple weeks ago, is an OBGYN over at Springfield Hospital. I was practicing at the hospital in Rutland for about 7 years, and then was kind of pulled over to Albany Med and worked there for just over a year, worked with the residents and the med students and the fellows, but then wanted to come home to Vermont. And so I've established my practice this past year and been up and going. And you guys wanted me to talk a little bit about ticks, so we could talk
Yes,
about that.
please.
And that's, even before we got on, it's a hot topic and it's an area of expertise for infectious disease doctors. And there's a never-ending amount of information being generated. And there's also a lot of information being generated that's not helpful, and so I hope to clarify some things.
Okay, great. So where would you start with that? With ticks. This is the time of the year, right?
It is. It really starts when you look at, without boring you with all details, but the life cycle of the tick. It starts spring, and then it can go really right through the fall. You have in the early spring and into the summer is where we see a spike of number of folks getting tick-borne diseases, and that's because they get bit by what we call the nymphs. And these are tiny little,
Those are tiny little black
flecks
ones?
of pepper. They're tiny. And that's why when you look at a lot of times, half the people who come to me, or when you look at the literature, half the people who have a tick-borne disease will say, but doctor, I never got bit by a tick. It's because they're so small, you never notice.
Interesting, yeah.
And so we see that, and then later, right through the summer, into the fall, we see cases of tick-borne disease, and that's dealing with the adult female tick. And because they're trying to get not to be too blunt, their blood meal before the winter. I know.
Yuck.
And then things seem to calm down. But technically, if the temperature is above freezing, although if it's below freezing, we don't see many cases in December, January, February. But if we have a really mild winter and you're out there trying to catch up, I admit I'm one of them. Oh, I should have done this. I should have done this in my yard. If you go out, there's a potential that you could interact with the tick and get bit as well.
Like in February, March.
Yeah, you
Interesting.
could. And so, but if you look at the state, Vermont Department of Health does a wonderful job with it. When you look at the statistics, it's really spring and then it goes right through the fall. So.
But clarification for me, the nymphs, when they bite you, they don't attach and hold
They
on?
do. There's larvae do too, but we won't really include them. But when you look at the nymphs and the adult ticks, the longer the tick, and they all bite, but you don't, it's interesting the way they develop, we don't always sense that they're biting. It doesn't hurt. And it's because they have almost an anesthetic or enzymes in their saliva when they bite us, so we don't really always feel it.
So if you found, if numerous times you have found them crawling on you, is it likely that they bit you?
It's a great question. No, I'll break it down in two things. If you find a tick crawling on you and it's not engorged or a fat tick, it's unlikely having bit you because what it often does, I know, if you have pets, you worry about that. What often happens is, or what does happen is that tick bites you and then it'll stay on you for a couple days and it's feeding, and then when it's had its adequate feed, it falls off. But we often will most people recognize this with their pets, dogs. They see a real fat tick. Well, that tick's been on for a while. And the longer the tick is on you, the more likely you're going to get a tick-borne disease. Now, it's important, the tick is just a vehicle for the disease. So, for example, Lyme disease, the organism is called Borrelia burgdorferi, and it's sitting in the gut of the tick. And the longer, if this is the tick and this is in, the longer that tick is attached, the more likely that infection is going to move from inside the tick into you. And so the goal is get that tick off as soon as you can. And they like to use this, the state does this, CDC does this, it's these 4 words: protect, check, remove, and watch. So protect would be, all right, protect yourself. So how do you do that? You recognize where ticks are. Ticks are in Vermont everywhere. But they describe like brush and uncut grass and leaves and all this. And I like to interject here with my patients is that there's this misconception, this myth, that ticks will drop from the trees. They don't. Ticks are going to be at low level because we're accidental hosts. They're going after mice and deer, and they're low ground cover, and the ticks just sit there, and I'm a tick, and they leave these front feet, or my kids would say paws, up, and you walk by and they attach you, and then they work their way to on your body, and they bite you, and they get their blood meal. So you got to recognize, all right, this is where ticks are. And so what do? Well, ideally you avoid that. But as I was saying before, I don't like to create anxiety so people don't want to go outside. Our state is beautiful, and this year, this time of year, it's even more beautiful. And I want you to go outside. You just have to be aware, and that's really, for me, one of the important steps in this. And so maybe walk in the middle of a path. Don't venture off into the woods unless you have to. You can use protective clothing, and just wearing long sleeves, pants, boots, light colored clothing. People say, why? I said, because you see the ticks easier.
Oh, I always wondered that. You're right, because black ticks, you're not going to see black ticks on black pants.
Yeah,
or black dog.
And then you can get permethrin coated clothing. You could coat it yourself, or you could buy it. And what's nice about that is on contact, it can kill or definitely repulse the tick. Don't put it on your skin, though. There's products like DEET, which you could purchase. The problem with DEET, and I'm not anti-DEET, is it's really good when you first apply it, but as soon as it dries out or you sweat it off, it's not as effective anymore. So you have to apply it again and again and again, and some people find that problematic. And the last thing when I think about protecting yourself is, protect your pets, because a lot of people, their main interaction is what we talked about dogs, is walking their dogs. And so make sure you consult your veterinarian and say, all right, what can I use to keep ticks off my dog? And then check is the next word, protect, check. It's check yourself, check family members, check your dog, ideally before you go inside, because you could find ticks on you early and you get them removed and there's really not going to be a problem. So check yourself. When we tell people if you can come in, take a shower, kind of wash those ticks off, stand in front of that mirror. You're not being vain, but you're going to look at that. Get a handheld mirror, call in your partner and say, can you look? Because you can't see behind your head or your back. So that, with regard to your clothing, we tell people if you want to put it in the dryer, high heat, 10 minutes, it kind of kills the ticks.
Does it? Okay.
If your clothes are damp, maybe a little longer, and when you wash your clothes, ideally you wash it in high heat. And again, checking those pets, because the pets, I've had patients say, well, I never go outside. I go, okay. And sometimes it's interesting. They say never go outside, and you ask, oh, how do you get your mail? Oh, I walk across my lawn. You're like, how do you go outside? But these pets could bring ticks inside. And so that's the check part. But if you do find a tick, I'll finish this off. If you do find a tick, the sooner you remove it, the less likely you're going to get a tick-borne disease. Now, if it's just walking on you, like we talked about before, I know.
Been there also all spring. I had a bunch of them.
If they're walking on you and they're not engorged or fat, meaning they haven't probably fed, you can't assume, but you could presume. You just take them off. If you find a tick on you, the key thing is you get a pair of tweezers, or they have these tick removal kits you can buy. Yeah, the screwing
twisters,
thing. Go as close to the skin, the mouth parts you can, and just pull straight up. Don't squeeze that tick. Just pull it straight up. If there's little mouth parts left in, I know, it's never good. Don't dig for them. And I can't emphasize that enough because you can cause skin infection. There are other things. And you think being my sister, having her brother an ID doctor, I've told her this a million times. She told me the other day, oh, her son had a tick on her, and I said, you didn't dig it out. She goes, oh, yeah, I did. I go, I've told you that a million times. So remove that tick. And then the final thing is to watch. And what do we mean by that? Most symptoms develop within, if you look at the different tick-borne diseases in the state, between 3 to 5 to 30 days. So if you remove a tick and you're asymptomatic for the next 30 days, it's unlikely you'll develop any tick-borne disease. Now, there's some nuances in it, but we can get to that.
Yeah.
It's just a big thing. It's protect, check, remove, and watch. Those are the big things you see repeated.
So if you, like, say the ticks came in and they came in on you or they came in on your dog, can they, and you didn't happen to notice them, can they live in your house for a certain amount of time?
They can, because they survive. I know. They survive.
I was hoping that was one
I
of
know.
those
I'd
myths.
love to give you a different answer. They survive on the blood meal, and they don't feed as much as people think they do. And so the life cycle of a tick is only 2 years. And so you get the nymphs want to feed because they're just emerging from being larvae. They feed, and then adults will feed once in the fall. So they could be in your house, and they'll be waiting for you to walk by. So, yeah, that's why, checking. That's why we say, but check before you come in, so they don't come in. You were going to say.
They don't eat anything but blood then.
Yeah, and like I said, we're accidents. We're not
yeah.
supposed to be. It's supposed to be
like
mice and deer. And I've had patients swear they don't have ticks in their property and I say, well, then you're the only one. And I did have a colleague who once had a patient who was so adamant that they didn't have ticks. He said, all right, because he was a tick researcher, and he goes, there are. He told them to get a 2x4x8 and nail or staple a sheet, white sheet, and drag it across your yard and then flip it. Yeah, the patient never claimed he didn't have ticks. They're there.
Yeah.
Our ticks, the black-legged or deer tick being the when you look at, it's 94% of all our ticks in the state are black-legged ticks, and the downside is 50% of those ticks are carrying one of the multiple infections we can go into. But the black-legged tick also accounts for 99% of all the illnesses. So it's really, we have other ticks. I'll just mention we have a American dog tick, we have a brown dog tick, we have a Lone Star tick, we have a squirrel tick, we have a woodchuck tick. We have 12 different types, but it's really the deer tick or brown-legged that causes the majority of the problems.
So this is just a question I've always wondered.
Yeah.
I know you probably have another thing you're going on to, but
No, it's good.
so every year I take my dog and she gets her tick preventive.
Right,
So for dogs, you can get tick preventive and then a tick vaccine.
right.
So is there a reason that there's not been a human? It's probably a hot topic.
It
but
is a
there's not
very hot topic.
a human vaccine?
So there was, and I could anecdotally I could say I grew up in Connecticut, so Lyme. We were saying before, old Lyme, Connecticut. Very proud that there are big diseases named after them. I'm sure, but I remember I was landscaping as a high school student, and I was working for this group, and they volunteered. I was 17, so I couldn't, but they trialed. This is ages ago, like 15, 20, or more than 20 years ago. Make myself feel old. But they trialed a vaccine at that time, and it just wasn't effective.
Okay.
And there's been ongoing, it is a hot topic, research of how do we develop a vaccine because there is so much Lyme disease. I mean, you look at tick-borne diseases in Vermont, and I think it's 2008, we'd have 400 a year. Now we have over 2,000
Oh my gosh.
people infected a
Yeah.
year. So, and you think, when we think of tick-borne diseases in particular, you think of Lyme disease being by far the most common. There's about 10 years ago, and then COVID slid down a lot of the other research because we were focused on that. But you looked at the number of cases per state, and Vermont was in the top 10, but then when you adjusted per population, we were number one.
Really?
They're not really bragging about, come ski, maple syrup,
Get Lyme
checking ticks.
disease.
So it's not surprising people aren't aware of that, but we have a lot of cases here. So, and there's a lot of different debate why. Why do we have more? And it's like, are we testing more? Are we much more aware of it? So that's how we see more cases. Is it that we've changed basically the environment, and there's climate change arguments, but there's also, if you went back to Vermont 100 years ago or 150 years ago, a lot of the property was farmland. And so there wasn't that environment for the ticks, the mice and the deer to maybe, and there's a lot of debate. There's no clear answer. We're just seeing more cases.
Yeah.
So what are the symptoms of Lyme? I mean, I'm sure people know, but it's always good to hear.
Yeah,
what it is.
it's funny. There used to be an old saying by William Osler, who was a famous surgeon, used to describe this one malady as, if you know this, you know medicine. And I argue if you know Lyme disease, you know medicine, because you have general symptoms. You have fevers, chills, nausea, vomiting, malaise, joint aches, joint swelling. You can get later clinical manifestations. People get a Bellows palsy or a facial nerve palsy. You can develop meningitis. You can develop encephalitis, which gets you confused. I can keep going. You can get pre-syncopal, or like you're about to get dizzy and black out. You can black out because that's related to a heart block. We see that. And you can get, I'll just end with, you can get Lyme arthritis, which often is a single, but it could be a few joints that get swollen, and it kind of confuses people because they think it's a staph or strep infection. In fact, it's Lyme disease. The Lyme disease is, I mentioned, the most common. We do have, not that I feel like I'm a bearer of bad news, we do have other tick-borne illnesses. That's why I'll say as an aside, I laugh because my wife's an OBGYN, and we'll focus on the OB, and I say 99.9% of the time people are very excited to see their OB. I mean, people brag, I'm going to get my picture, when people say they're seeing their ID doctor, they're like, oh, what do you have? So I get that. So I mean, it's the world I live in. I've accepted it. But when you look at the hierarchy of tick-borne diseases in Vermont, you have Lyme disease by far, number one. And then below that is something called anaplasmosis. And it's also called the summer flu. So you mentioned great question about what symptoms. Well, if someone has an influenza-like illness in the dead of the summer or early fall before the flu season, you got to look for, and you live in Vermont, you look for tick disease, and anaplasmosis presents like that.
Interesting.
And it's acquired through the same black-legged deer tick, and then the fancy name is Ixodes scapularis. That's the tick that carries it. And what's odd but not is that tick can carry, like, you could technically, and I've seen it, get more than one tick-borne disease from a single tick because they
Those
can
nasty
carry
little
more.
buggers.
I know, so they can carry more than one. But that's number two. And number three is something called babesiosis, much less common. And I should say with anaplasmosis, it can be serious. And if you have a lot of other medical problems, sadly, but fortunately, there's a very few people who die from it, but they have been reported. And if you look at people who develop anaplasmosis and you look at Department of Health and they gather data from urgent care centers and from hospitals, a third of the people who get anaplasmosis are admitted. They often need to be admitted to hospital and initially get treated. Because I've had patients who are in the ICU and I get called and it's my world, so I know what to think about. And I had a patient I saw, and his wife, they were thinking about intubating him, doing all this stuff, and there were great doctors that were looking after him. And they called me, and I talked to the wife. And anytime I hear anyone's doing any logging or anything like that, I'm like, okay, he had ticks on him. Yes, he's had a lot. We gave him the treatment, and it's the interesting thing about anaplasmosis. You get treatment a day or two, you can feel completely normal. And the nice thing, there's no long-term effect of anaplasmosis. But then the third is babesiosis, and that's a population that's tricky because if you have problems with your immune system or you have liver disease or you have no spleen, you're at very high risk for getting complications. And the way we diagnose them is a little unique, is we do a PCR, which is a special test looking for components of their genes, but we also do a blood smear. So they take a drop of blood, the pathologists, and square it off, and they count what percentage of all that are infected, because believe it or not, you could see it in the red cells. You could see it. If you ever seen, every now and then you see some show, they'll say, oh, this is malaria. Look, there, it looks like malaria, believe it or not. And so it's always tricky when someone's like, I came back from Southeast Asia where I didn't take my malaria prophylaxis, and then I vacationed in Martha's Vineyard, and now they show up at your door now. And that happened when I was a fellow. I'll never forget that. But those folks, you count the amount of what percentage, and if it's a high percentage, then if they presented to Rutland Regional or the Preventive Springfield, then they will have to be transferred to Dartmouth or UVM, because there's a specific, it's a exchange transfusion where they kind of filter out those bad. So it's serious, and we have to be very careful. And then there's other tick-borne diseases, not very common, we see here. We don't see anything called in the state, or at least if we do, it's always interesting because they're like, oh, I was here, and then they show up, they come home, and then you realize, oh, you got that there. Ehrlichiosis, there's hard tick relapsing fever, and there's Powassan virus. So there's other stuff you see, but we don't see those as often. The big three, Lyme, Anaplasma babesia, with Lyme being by far the most.
So I have one question, and then we're down to about 2 minutes.
Okay.
So where's your office, and how can people contact you?
Thank you. I'm right in Rutland. I'm right. My practice is, it's 69 Allen, Suite 8, and there's the number. They could call. I don't need necessarily a referral from your primary. You can just call them. We'll get you scheduled. I'm fortunate the way my schedule works. I get people in same week, maybe sometimes even within a day or two. Wow. And it's why I established the practice, because I knew, as I had practiced in the area before, I know, and this data just shows, I know there's a need for people, because there's a lot of need for people to have the correct information and the correct treatment and the correct diagnostics and the correct follow-up. But I also know there's a lot of people who, unfortunately, as we know, not everything on the internet is true. There's a lot of misinformation, so it's important, and it's I don't mind seeing folks who have a lot of questions. I mean, I've had patients who finish treatment and just are concerned, saying, did I get everything done? And I want to be available to my colleagues, my primary care colleagues, where there's so much stuff coming in that I'm available to see any folks you have questions about. So.
Perfect.
That's great.
Perfect.
Well, thank you so much for
Thank
coming.
you for having me.
Yes, this has been great. I know.
This is great.
There's so much more, but
Well, to do
I didn't
part
mean to scare you. I hope
No.
we'll do part two. I hope
two.
I didn't scare you. I always say, don't be afraid. Go outside. We have a beautiful state. Enjoy it, but just be aware.
Yeah.
Just be aware. We'll have to talk after. I have to make sure you still go outside.
Yeah, no, I have to. I have a dog. She has to go out.
And that's all the time we have this week. We'll see you next week on the feed.
Thank
Thank
you.
you.
Thank you so much.
Marty on the